everyone, and welcome to Iconic Heroes. I am Meghana along with Kris Murthy here, and we are privileged to be part of this incredible show where we will feature and present you people in all walks of life and from across the world who have made iconic contributions and truly made a difference in all our lives at the highest levels.
That's very true, Meghana. And I'm sure the pinnacle of successes and contributions of these iconic heroes will serve as a role model and inspire all of us, especially our next generation. This, we hope, will unite our thoughts and actions to create a better world all around us.
I totally agree, Kris. In our inaugural show, we are very pleased to present you an extraordinary human leader whose services in the field of medicine has made a tremendous difference in the lives of hundreds of thousands of people. And Kris, the floor is all yours to introduce and share your in-conversation meeting with our very first iconic hero.
That's right. Thank you, Meghana. From humble beginnings, this gentleman has achieved pinnacle of successes, especially in the field of medicine, by his extraordinary contributions, not only in his expertise of cardiology, but also in his astute ability to visualize, lead, transform, and deliver high-quality healthcare to masses of people, especially reaching out to downtrodden as well as people in remote villages and rural areas. In addition, his operations and leadership expertise in training and motivating his team to provide services par excellence and consistently provide affordable healthcare has truly received international recognition.
It's time for us to present to our audience our very first iconic hero on our world premiere show.
Ladies and gentlemen, please welcome our first iconic hero, the one and only Padma Shri awardee, Dr. C.N. Manjunath. Thank you. Thank you. Thank you both for this. Welcome, Dr. Manjunath. It's truly an honor for me.
It's my pleasure.
And for all of our audience, actually, that you are on our show. Thank you for sparing this time with us. Dr. Manjunath, can you kindly brief our audience how you were able to transform a low-budget government hospital into a globally renowned, high-quality, affordable healthcare center?
See, it was always at the back of my mind during my undergraduation in medicine, even during my post-graduation, postdoctoral in cardiology. It was always my dream. If I get an opportunity to head a public heart institute, let me show this state, let me show this country a government hospital can function like a five-star corporate hospital for a common man. But the bottom line is we should be able to provide high quality services and high quality healthcare services at an affordable cost to the cross section of the society and in deserving poor free of cost. That was always my vision, and I am very happy to say I have completely accomplished in this particular area. See, the question is, yes, to transform a government institution into an institute of excellence, it's not a joke. There will be a lot of hurdles, a lot of obstacles, and even a lot of regulatory issues will be there. So what I did was, yes, government does give some budget, but this budget will not be sufficient. And what I did was, when I took over Jaideva Institute as a director in the year 2006, at that point of time, there was more loan than the deposits in that hospital.
Yes.
Then at that point of time, this Jaideva Hospital, which is a public government-run Karnataka institute, it's a public institute for all practical purposes. So, which has got at that point of time the bed strength was somewhere around 300. So, today it has been increased from 300 to 2000 cardiac beds exclusively for cardiac care. So probably easily this is one of the largest heart care destination globally, because there are very few institutions which have dedicated 2000 cardiac beds. And also I coined 3 important slogans. I literally followed these 3 slogans. What is those 3 slogans? Treatment first, payment next. Second is life is more important than the fire. Third is humanity is priority. So to do all those things, because it's very important, whatever words, because practice and preaching should be same in my work. Because there are a lot of people who preach us but don't really practice what they preach. So as far as I am concerned, I'm very conscious about it, that whatever I preach, I should practice. So I called, at that point of time, there were 400 employees in that institute. Today, of course, it is touching 3,500 to 4,000. That's it. So our outpatient load was less at that time. Even revenue generation receipts were less. At the same time, you can't see the suffering of these poor people, poor or even lower middle class and middle class, because you know the healthcare cost of cardiac procedure is pretty expensive. Although, of course, compared to United States, it's relatively less, it's significantly less in India. But the problem is, in India, for poor Indians, it is still expensive. So I called all my employees, I appealed to them, let us contribute at least our 1-day salary to the poor patient fund of this institute. Because my opinion, charity should start at home. So then all agreed, they all contributed 1-day salary, whatever it is. The amount may not be big, but that gesture, that gratitude, and that I wanted them to get involved in our mission to provide a quality care at an affordable cost. So then I started asking various cash-rich organizations, because I said, so we are interested to build up a very good corpus fund for the benefit of poor people. So there are many government-rich organizations, corporations. So they responded to us. And I also rolled in nearly 50 to 60 charitable organizations and donors. See, donors will come only when they are satisfied whatever money or whatever equipments they donate is going to be properly utilized, whether it is system is transparent, whether its system is non-discriminatory. See, throughout my career, I have seen to that everybody is treated alike, whether they have money, no money, documents, no documents, insurance, no insurance, they were all taken care of when somebody comes to an emergency room. So then what happened, our patient load also started increasing. Then I adopted what is called volume cum revenue model. What is this volume cum revenue model? If you treat more number of patients at a lesser cost, still you can generate some money. And at the end of the day, about 10 to 20% of patients can be still treated at a subsidized cost. Because I will just give an example. There is an aircraft which has got a seating capacity of 250. Whether you carry 20 passengers or whether you carry 250 passengers full, operating cost is same. Yeah. Same number of air hostesses.
Very true.
And the fuel, same amount of fuel. So I adopted that concept. Let me go flight full, and in that flight full journey, at least out of 250, at least 50, 60, let us take them free or at a subsidized cost. Then the donors, how we convinced the donors was, I brought them to the hospital. and made them see the sufferings of the people, and they were talking, interacting with the patients, and they were very much convinced. Many patients have said, we did not have even $1, I did not have even 1 rupee. I have undergone open heart surgery, I have undergone an angioplasty, I have undergone a pacemaker. So when the donors got convinced, here is a system which is transparent, which is non-discriminatory. So they came forward in big number. Just for example, Infosys Foundation, chairperson Sudha Murthy and Narayan Murthy, they are giants because they are one of the innovators of software company in this country.
Absolutely.
So once Mr. Narayan Murthy, who is the co-founder of Infosys, he visited our hospital. I brought him, I requested him. So he went around the hospital from basement to 7th floor. He was interacting with the patients and it was full. Hospital beds were full, ICU was overcrowded, and he was interacting with them. Then the next morning, the chairperson Sudha Murthy, Srimati Sudha Murthy called me. We have decided to build an hospital for your Jayadeva Institute. But she was very quick to ask another question. Dr. Manjunath, how much of tenure as a director is remaining for you in this institute? Then I told her, I will be there for 3 years. If you are going to be there for 3 years, we are going to build this 350 bedded. So that's how today Jayadeva Institute of Cardiovascular Sciences in Bangalore itself has got 1,000 cardiac beds. Earlier it was 650. With a generous contribution from Infosys Foundation Chairman Sudha Murthy and Narayan Murthy, we have added another 350 beds. Then I was wondering, of course, Bangalore is a capital city of the state, and it is quite cumbersome, it's quite troublesome for patients coming from other parts of the state. Those who are coming from 700 kilometers, 600 kilometers. So then we decided to take this affordable cardiac health care of Jayadeva to other parts of the state. We established 400 bedded world-class cardiac hospital at Mysore, which is about 150 kilometers from here. Then also we established 370 bedded hospital at Kalburgi, which is 650 kilometers from here.
So Kalburgi is originally Gulbarga, right?
Gulbarga,
okay,
yeah.
okay,
Yeah.
right.
So another thing, the donors, see today, yes, I showed the state and the nation how a PPP model can work, what is called public-private partnership. Public-private partnership. Yes, we are very thankful to the government, we are very thankful to the donors and grateful to the donors because there were some of the donors who are donating equipment, some of the donors have built some blocks, and some donors were continuously supporting the treatment of patients. So this is how I could able to generate some resources. That is one. Another important thing, building and equipments, yes, they are essential to run an organization. Building and equipment alone cannot deliver good healthcare services.
It takes a
So
village.
we need to create an excellent working atmosphere.
Awesome.
And today, see, Jayadeva Institute of Cardiovascular Sciences has 120 full-time interventional cardiologists. I don't think anywhere in this world under one umbrella there are 120 full-time cardiologists, 60 cardiothoracic surgeons, then about 50 cardiac anesthetists. But most important is their salary is just meager, because what salary they are getting, what remunerations are getting, it is not even 1/10 of what their counterparts are getting in a private or a corporate hospital. But you can ask me how, despite giving a very low salary, how we could able to retain them. Virtually brain drain is zero despite giving a low salary, because I made them enjoy their work.
There you go.
And also there was an excellent team concept. and I made to believe them they are owning this hospital and let us all serve this. So they were taking pleasure in doing procedures, enjoying procedures. So this is where a leadership comes.
Amazing, Dr. Manjunath. Actually, you answered a huge part of my next upcoming questions because the budgets from hospitals are remarkably low, and in this era of rising costs and you know, that question you answered completely so well, that this private public coordination that you have masterfully achieved while taking great care of your employees, I shouldn't say employees, your associates and team. That's remarkable, Dr. Manjunath, because you know, you come across as a very humble, human and soft-spoken gentleman, yet you are amazingly respected at the highest levels by everyone, your associates, your team members, patients and everything. And then you brought up another issue of non-discrimination based on standing of finances or religion or whatever. And I would like to tell our audience, I myself am a recipient. In 2000, almost 15 years ago, I myself had some chest pain and I came to Jayadeva Hospital. So I'm a classic example of what he's saying. And I would like to share that quickly with you. I went there, and even though I knew Dr. Manjunath, I did not announce who I am or whatever. I just went to the emergency at 12 o'clock at midnight. And unlike in US, where if you go to an emergency, it's the physician assistants who attend to patients, there were 3 cardiologists who were there in emergency, and they took care of me. They did ECG, everything that I needed. And I was about to depart and talking about non-discrimination and treating everybody on equal terms. And the bill came out to be 92 rupees. And there is, in the United States, I worked there, and the president at that time, President Barack Obama, was trying to pass the healthcare bill there. And I was flabbergasted. I went to his billing department, your billing department, and said, look here, I'm from US. I would like to pay the whole cost. I don't want the subsidized rate. And the hospital staff clearly told me, sir, here, it's the same for everyone, whether you come from US or anywhere, it doesn't matter. You came to our facility, our doctors will take care of you, and there you go, 92 rupees. I wrote to President Obama and congressman there, and they in turn wrote
92
back.
rupees means $1.5.
Well, it was, yeah, $1.5. I got all the treatment by actual cardiologists. And I was, you know, this is something that we were trying to do in US at the time to get affordable health care. His officers wrote to him, reached out to him and said, thank you for doing what you're doing, and we are trying to pass affordable health care bill. And they asked me to write to all the congressmen what my experience at Jayadeva, which I did. And you know, I want to say that directly or indirectly, you are part of the affordable health care bill that passed in US. Anyway, so
and also another important thing, in a hospital sector, there should not be too much of regulations.
yes,
Because you have to give more importance to the life. Okay, I mean, just I will give an example. Somebody comes with a massive heart attack, somebody comes with a brain stroke, ischemic brain stroke, and you may not be having insurance. So you may not be having money also. So in that context, there has to be some humanitarian approach. So each hospital should have some reserves for treating such patients, at least in the initial golden hour. So because life, I mean, comes once, goes once. So I think this is where, yes, certainly we need a lot of money to maintain the hospital, to maintain other consumables, all those things, I agree. But still, even in a private hospital, I'm talking about private corporate hospital, at least 10% of the beds can be reserved for the poor people, or at least they should be able to treat those patients on those 10 beds at 1/4 of the regular cost. So that should be the social responsibility of any bigger organizations.
Amazing. I would like to share with our audience that Dr. Manjunath's humanitarian values is impeccable. I know that you start your day as soon as you enter the hospital. You go and meet the people who clean the floors, you meet those staff, what's happening, the hygiene, you go and see the bathrooms, then you see all the patients who are your children, and then you go to your office, isn't it, Dr.
Yeah, that's correct. See, because always you may be head of the institution, you may be the director of the entire institution, but you should be more approachable, accessible to your colleagues, and you should be more accessible to patients and their problems also. Very important, because there should not be, you should not work in a watertight chambers or air conditioned watertight chambers. So then only you will understand problem. If you are mixing with the patients, you are mixing with the people, you will know what are the problems they are facing. Otherwise, you may not be having a first-hand experience of them. So many people have asked me, Dr. Manjunath, you have brought a metamorphic changes in a public hospital, particularly in a government-run public heart institution, how it is possible. So what is your motivation? Who has motivated you to do all those things? So for me, the motivation is the sufferings of the people, sufferings, because I don't want them to really suffer. And also see, already they have come to the hospital with lot of pain, so you should not add some more pains to them. And by saving one patient, you are not saving one life, you are saving the entire family. So with that concept, so that is how, and we can, other question is, yes, you are very, you are telling you are very soft spoken, you are very kind, but still you get derive a lot of respect from the colleagues and the patients and the community. See, that's what, in my opinion, you can get lot of things done. In fact, with love and affection, you can, because affection works better than perfection. Affection works better than perfection. You can get lot of that goodwill, that love, that you should be smiling with your colleagues, you should be smiling with your patients. That also brings a great bondage and also builds up a huge trust also. So, and with love and affection, we can extract more work from your employees than than being very rude or than being very highly regulatory and all. And most important, you should provide space for others to grow in your own department, in your own institution.
Very true.
Because yes, I agree, talent and skill can take you to greater heights. Talent, skill, hard work, and your sweats and all can take you to a greater heights. And the professional supremacy in any profession is like a pyramid. When you reach the top, space available at the top is very small. To remain in that top position for a longer time, rather than your skill, rather than your talent, what works more is your attitude, behavior, and mannerisms.
So very true. Dr. Manjunath, you touched base on two things. In a microanalytics, you started with Jayadeva, expanded it to Mysore, then to Gulbarga. Now, let's look at a slightly more macro level. You believe in citizens' right to healthcare. In your heart and soul, every person on earth, you believe that they should get healthcare. That's your goal. You're not going to stop there, I know that. So now, India, under the leadership of our Honorable Prime Minister, Sri Narendra Modi, have brought many programs understanding the needs of Indians, and they've given prime importance to healthcare, made some very strong reforms that we see, and which is really commendable, by the way. We are looking at 1.4 billion people. So what they did was to make financial arrangements through different organizations for the citizens of India to access healthcare. Now, 70% of Indians have availed the Prime Minister's goodwill and financial benefits towards healthcare in one form or the other. But the other 30%, it's astounding numbers, Dr. Manjunath. 30% of India is 400 million people
who have no access to healthcare. And some of them don't even want it because they are scared about the health rising costs. Not everybody is Dr. Manjunath. Now, having said that, what you were able to do on a micro analytics, how would you want to see India? What would be your plan to bring awareness, and what would be your wish and vision to have these accessible healthcare facilities across India to reach out for the 4,000 lakh people? Do you have some vision and plans?
See, as you know, India is a country, whether it is politically, culturally, or even for that healthcare wise, it is in diversity.
Yes.
So, in some pockets, healthcare services are good. In some pockets, that means uniformly it is not accessible to cross section of the society. In southern states, the healthcare services are a lot better compared to the north of India, all those things. And Honorable Prime Minister Narendra Modi has come up with this Ayushman Bharat scheme. So, under Ayushman Bharat scheme, the poor patients, we have some definitions and guidelines for that. So, they can have they have an access to the free treatment under that Ayushman Bharat scheme. But again, that scheme need to be strengthened further. Because the revision of rates need to be taken because of inflation, the cost of consumables and today in India, 30% of the healthcare is taken care by public hospitals, by government hospitals.
30%, that's a huge number.
Yeah, 70% of healthcare provider is still private. I think we have to work together. Both government institutions as well as private hospitals have to work in tandem. And most important, you should also look at the cost. There is no uniformity as far as the costing of the procedure is concerned among the private hospitals. Some are very expensive, some are reasonably okay, like that. So, and after Narendra Modi took over as Prime Minister, the number of medical colleges have increased. What used to be around 400, now it's somewhere around 780 medical colleges.
That's amazing.
So, 780. So, through medical colleges, we should able to provide, because medical colleges, government medical colleges normally do not charge any patients, and there are a lot of free beds are available. So, particularly in North India and Eastern India, in the last 5-6 years, nearly 250 medical colleges have started. So, they should able to take care of these things. And even the district level hospitals, among the district, because one of the concerns that what we are facing today, the critical care or the emergency services need to be geared up, particularly. Yeah. Suppose somebody comes with, for example, 13% of deaths in India today is due to accidents, road traffic accident. It's a I mean, mind-boggling number. 13% of deaths in India is due to road traffic accidents. So that's where we have to take some preventive measures. And maybe for every 125 kilometers of express highway or national highway, should have what is called trauma care clinic to provide immediate care in the golden hour of road traffic accident, because many die because of blood loss or some need emergency CPR, those services.
Dr. Manjunath, you brought up a very interesting point which has a bearing on healthcare with regards to road accidents, the 13% of people dying on the highways. You know, I lived abroad for about 40 years and I'm now so happy to drive on those fast freeways. But what I see in India is a lack of education and training. I think it's a shock. All these people have fast cars now. So before they come to the clinics that you want to establish in between, there has to be a requirement from the RTO to have these people go through a video program, how to drive on the highway at those speeds, putting the indicators on, slowing down, how much distance you have to keep between vehicles. We see people driving at 120 kilometers neck to neck.
No distance.
You have to have the ideal Western rule is that you have to keep 10 feet for every 10 miles. You should defer. You know, so 100 kilometers if they're driving, there should be 6 car spaces. for
That's
them.
correct.
So anyway, the only reason I bring it up is because it has a direct bearing on healthcare. But thank you for bringing it up, because this is something I hope our RTO authorities and state transportation department says that in order to give license, you have to pass at least the video test.
And we have to also, because the burden of lifestyle disease in India is very high, burden of lifestyle diseases such as heart attack or cardiovascular disease. 65% of deaths in India is due to lifestyle driven diseases. That is cardiovascular disease, number one killer is heart attack. Then we have high blood pressure, we have diabetes, we have stroke and cancer. So unfortunately in India, number one, the burden of these diseases is high, and they are occurring at least 10 to 20 years earlier compared to the Western counterparts. So there was a time children used to bring parents for the treatment of all these diseases, but in India today, the landscape has changed to that extent that the parents are bringing their children in the age group of 20 to 40 for the treatment of heart attack, high blood pressure, diabetes and all. So this is where lot of awareness has to be created, because in my opinion, health for all, yes, that is the dream. Right to health is our dream, and health for all should be our motto. I fully agree with that. But by opening medical colleges or by establishing more and more hospitals, I don't think we can achieve health for all. To some extent, we can achieve health for all. To actually to achieve health for all, you should provide clean air, you should provide clean water, you should provide unadulterated food, unadulterated, balanced food. Because today we are talking about air pollution. Air pollution is also an emerging risk factor for various diseases, not just lung disease. Maybe even heart attack is considered to be one of the, air pollution can also trigger heart attacks. So I think we need to educate our children from the school days regarding their diet, exercise, and another important thing is, yes, they are all glued to these new gadgets. Yeah, mobile phones, YouTubes, and computers, iPads, and all. So there they have. I think, of course, it is becoming an addiction. I agree. At least through them, you have to educate children regarding their lifestyle, healthy habits. Although awareness has to be. So prevention is always better than cure. Precaution is still the best. But definitely, because the country is marching towards a better healthcare system, accessible healthcare, and areas where it is inaccessible, we can always make use of artificial intelligence, machine learning, or you can provide tele-ICU services or tele-consultation services to areas where it is not accessible. So I think this is how we can cover up all these patients.
Now you also brought up one more point in the environmental thing. I do have a question on that. The radiation that is emitting from these gadgets, you know, when we go, you would advise me not to keep the phone here in this pocket or on the hip pocket, but no phone company will say don't keep it close to your ears, because they won't have any more sales. The radiation that the phone emits, the electric cars, the radiation has increased, which is a concern in environment. The other concerns are the younger generations going with fast food, convenient food, and it has changed the dynamics of eating with obesity that you begin to see, which is leading to this cardiology text. What would be your message to the younger generation to stay away from certain things and be careful with certain things, and how can they manage? And they have to start being disciplined to start cooking and eating healthy food.
So certainly food habits and food practices have got a lot of bearing on health. See, in these modern days, what is happening, these children, as well as teenagers, they are attracted toward these fast foods. So I think, what is the definition of fast foods? In my opinion, those are the foods which takes away your life very fast. So I think we need to really educate, because every mother wants her child to be chubby. That's okay for first 1 or 2 years. So that chubbiness should not be carried into the teenage or beyond teenage. So they have to give a proper healthy food. Food should have more of fruits, more of vegetables, and more of sprouts and pulses, and less of fat. That is the reason one has to take care of 6S, we say. You take care of 6S for a healthy life. That is one, salt. Second is stress. Third is spirit. Fourth is smoking. Fifth is sedentary life. And sixth is sugar. So you address all those 6 S's, then you should have. And most important, today, too important to, modern risk factors have added. One is air pollution. Air pollution is considered to be a new tobacco.
Yes.
Air pollution is considered to be a new cigarettes. So this is where we have to reduce, because number one cause for air pollution is vehicular traffic. We need to decongest the traffic, and of course we should switch over from fuel-based vehicles to electric vehicles and all those things. And our road infrastructure has to improve. Wherever there is a traffic congestion, we should have either tunnels or underpasses or flyovers. And the second is the construction dust.
Yeah.
So you have to finish your projects on time. So otherwise what happens, you take up a project of a flyover or a metro or underpasses or construction, so which ought to have been completed in 1 year, you take 6 years. That further complicates, that further congests the traffic.
Yeah.
So this thing.
Very true.
And another important thing is we talk about BMW. So we should adopt BMW in our lifestyle. What is BMW? I am not talking about car. BMW is not car. B is bicycle.
Okay.
M is metro. And W is walking.
Talking about walking, you
Yeah.
had a funny line one of these days recently. Can you expand on that beautiful, funny quote you had about walking?
There is a robust data, robust data from various studies. If you walk at least 45 minutes to 1 hour, or around 10,000 steps a day, your lifespan increases by 10 years. So it is a great non-medicine medicine. It is a great non-medicine medicine walking. So there are 3 types of walking, just in a later vein. If somebody starts walking before doctor advises, it is called morning walk. Or if you start walking after doctor advises, then it becomes a warning walk. If you are walking with a spouse, it becomes a darling walk.
There you go.
So coming back to our health habits and health tips and all. So I think one is food, okay, and physical activity is very, very important. Some of the fast foods like salt-rich or saturated fats, and repeatedly reusing the oil in cooking, that will also this thing. So that is the reason. Another important, stress management. Today, in India, for example, take our Indian data, 35% of heart attack in India is occurring below 45 years of age.
Incredible.
So young Indians, middle-aged Indians are becoming vulnerable to heart attack and high blood pressure. So this is where, and we have our own study, nearly 30% who suffer heart attack in that younger age group do not have any conventional risk factors. Neither they are smokers, nor diabetics or high blood pressure. But people ask, why did I get heart attack, although I did not have some of the risk factors, known risk factors. But in our study, 17% who suffer heart attack in the younger age group had a strong family history of heart attack. If somebody in the family has suffered an heart attack before the age of 55, such family members are more prone for heart attack. So genetic basis is pretty strong as far as heart attack is concerned. So if your parents have lived up to 80 years without any problem, That is the best genetic balance sheet they are transferring to their children. And another important, stress is considered to be another tobacco equivalent. So why our younger generation in India are becoming more vulnerable to this thing? They are going through a lot of stress. And our younger generation wants to do too many things in a too short time. The thing which ought to have been achieved in 10 years, they want to achieve in 10 months. So they have to go step by step. And these integrated education courses are also putting a lot of stress, trying to take 2-3 examinations at a time for a different subjects. So I think because what is stress? When your performance is less than your expectations. In other words, if your expectations are more than the performance, you will end up in stress. Or if when your ambitions are more than the performance, it results in frustration. So I think younger generations are going through all these things. So we are in a jet age. We are in a very, fast age. And all those things. So today, screen addiction is also becoming a very big problem. It's becoming a mental disorder. So children, even kindergarten children are obsessed with YouTubes. So many. Today, children education today, at least in India, I can say, has become mother's examination.
True.
So mothers are terribly stressed.
Every year.
Yeah. So these are some of the.
So that brings up a good point, Doctor. See, we see a lot of emphasis and awareness programs on fitness, diets, and exercises, but we don't see. We see very little emphasis on mental fitness and purity of thought, actions, great human values really contribute towards a person's physical health. It has been proved even at Stanford that body toxicity and chemical balance has a direct bearing for all, and this is why the mental health fitness, which has not been getting as much attention anywhere in the world, and this is a problem in the West too, now that they realize. I can see your greatest strength is your mental fitness, isn't it? So what is your advice to all of us? You have talked about stress part of it. What about purity of thought, actions, and enjoying what we do, thinking it's not like work? Please share some of your own personal habits which can keep you with 2-3 hours of sleep. You are resting all day because you never consider it as work. You are doing it with pleasure. How can our next generation and all of us learn from you about this?
See, mental health, in fact, that drives your physical health. So mental health is very, very important, and we need to really address it very strongly, because it should start from your child. The way the parents, because the kids want love and affection from the parents. Today we have got a lot of working parents. So they spend, in fact, they spend very less time with their kids. This is where. So probably we need to, because for children, the mental health is very important, even for the adults also. Both are important. So for the adults, the mental health depends on the workplace wellness of that particular organization, workplace wellness. As far as kid is concerned, today, I think they are going through a lot of stress. So the education system is so stressful for them. So, and if both the parents, many of the children who otherwise would have performed well, they are getting stressed, and they are dropping out from schools, and particularly this gadgets obsession with your mobile phones or various other video games and all, that is also causing a lot of stress for the children. But my most important message is, it is the parents' responsibility to take care of their children, and whenever a child wants something from you, you have to listen and you have to address the problem. You can't say, I am busy, it's not possible and all. So that distance itself causes a lot of stress. Then because there are many types of stress. Family stresses are there, career stresses are there, study stresses are there. But definitely, I think one should, because life always belongs to those life, they will be successful if they believe in their dreams. That is correct. So success story comes for those people who believe in their dreams. There is no question about it. But you have to keep your expectations within your workable, reasonable limit.
Realistic mind.
Realistic.
Yeah.
So that is very, very important. Otherwise, you will be
Extremely true.
Never go for social and economic comparisons. This is where they get into the problem. So you just compare yourself. You compare you to yourself. Don't try to compare you to somebody else who is above you or this thing. And social comparison, economic comparisons puts lot of additional stress and all. See, many people in this world, they are not enjoying what they have. They are always thinking about what they don't have. So this is, I think this sort of because life, in other words, should have an air-conditioned system. Life is to lead a peaceful life, you should have air-conditioned thinking. What is this air-conditioned thinking? A stands for adjustment. C stands for compromise. AC. Yes. So life is a game of, acceptance and also compromise and adjustment. See, life alternates between pain and pleasure, but nothing is permanent. Even your problems are also not permanent, and your joy or happiness is also not permanent. So alternate. So you have to think that way. So never go for social and economic comparison. And suppose in a workplace, the mental health of the employees is directly depends on the attitude of the head of the organization.
Very true.
So we have, because if the head of the organization, whether it's a CEO or a director or head of the department, if he's having type A personality. In fact, type A personality is one of the risk factor for all these lifestyle diseases. What is type A personality? They are very rude and they never accept any good work done by others. They never share good things with others, and they are extremely jealous of others, and they suspect everybody, and also ego. They are egoistic and sadistic. So this workplace wellness absolutely depends on the attitude of the superiors. So that is the reason we have two types of superiors. One we call it as boss, second one is called as a leader. Boss is one who always troubles others. A leader is one who inspires others, who motivates others, and compliments others. And always a leader is one who takes less than his share of achievement, and he takes more than his share of blame. So that sort of a thing. And most important, as a leader, you should have a tremendous patience. See, 3 or 4 things all successful people will have. That is, one is patience. They will have momentary silence. They will have tolerance and smile. Smile is very important in a workplace. Smile is the best cosmetic. Smile is an universal language. Smile is the best antidepressant. And this is how we need to have a very good workplace atmosphere that reduces the stress, that improves the mental health of the people or the employees. The employer's attitude is directly linked to employees' mental health.
Very good. Dr. Manjunath, talking about communication, we see, this happens in every community across the world. Positive, effective communication, respectful communication, especially we are 2 men ourselves, especially between man and woman, and you have a lot of women patients who come to you who are not only, having issues with their health, but you could clearly see they're going through so many things, and we all should learn from you for positive, effective communication. And that politeness you talked about, you lead so strongly with that. People listen and understand and respect you. How important is that respectful, positive communication amongst all of us, and especially from a man to a husband to a wife?
Yeah, see, you have to care for each other. You should understand each other. See, lack of communication is the mother of misunderstanding, and you can't say all that, because what happens, that is the tendency. People become blind to their own mistakes, and as far as their problems are concerned, they become advocates. For others' problem, they become judges. So you can't go on judging everybody. See, you should understand people. And forget and forgiveness. Sometimes for small things, you should adopt that principle. Forget and forgiveness. See, for you to be happy, you have to decide yourself that I have to be happy. Then only this thing. So that's the reason life is best for those who enjoy it, and life is difficult for those who compare it. Life is worst for those who criticize it. So I think this is where we have to adopt. And you should have tremendous patience. In fact, patience and momentary silence, people say, is luxurious.
And they also say it teaches human values.
Yeah, and simplicity is ultimate sophistication. Simplicity. So, and you should always, you should listen to their problems as far as possible. Try to solve their problems, and you should always find out a solution for a problem. And when somebody does make a mistake, see, in my opinion, what is a mistake? They have done some initial mistake. I am talking about definition of a mistake. Despite advice, if he is not correcting, then it becomes a real mistake. Suppose if they are correcting it, then it doesn't become a mistake. So this is where you should give one small opportunity for your employees, for your colleagues to correct. And as I already said, you should provide space for them to grow, and you should look after them well, because in terms of incentive, in terms of salary, with their experience, we have to really increase all those things. You have to make them comfortable.
Excellent. So, Dr. Manjunath, we talked about your amazing achievements with the microanalytics of taking care of healthcare, I would say across Karnataka in a way, because the zones in which you established yourself would cover a lot of rural areas. And on the back of your mind, you are concerned about that, the rural areas, and people need to reach out. You also shared your vision, what can be done for the country in addition to what's happening under the great schemes that our Honorable Prime Minister has brought in. Now let's step one much further. See, for example, India has become a global leader in medical advancements, and it was very evident in the way they came forward to assist many nations with vaccinations and more during the COVID outbreak. Now, we all know going through this pandemic how important it is for all countries to work together. What is your vision to better coordinate efforts from all the nations, international organizations like World Health Organization, pharmaceutical companies, NGOs, and healthcare facilities? What is the communication gap that needs to be fixed for us to have a coordinated effort to take care of people across the world in your vision, plus be prepared for the next pandemic outbreak?
Yeah. See, in fact, this pandemic is coming exactly once in 100 years. If you look at the COVID pandemic to 2019, then 100 years back, it was said to be the influenza outbreak, pandemic. So we should have system in place actually. So I think we should have a very good medical infrastructure in terms of laboratory services, in terms of medicines. Today, India, in the last 10 years, the export of Indian pharmaceutical companies, whether it is drugs, consumables, and other medical gadgets, has increased by 60%.
Yeah.
So India has emerged as a global leader as far as pharmaceutical output is concerned.
Yes.
That is one thing. They have got excellent R&D units. And see, what happens, particularly during pandemic, any pandemic, new viruses come, new
strains of
new
virus.
strains will come. So should get prepared. For example, COVID vaccine was developed in record time of 11 months.
Amazing.
So earlier it used to take at least 10 years to develop a vaccine, because we have got an excellent genetic platform. So genetic analysis, genetic plates are well developed. So that is one. So WHO role, they have to share proper information well in advance, very, very important. So they should not I think this is where they should discuss with all, we have 196 countries. So this message should go well in advance, so that some preparations can, some precautions can be involved, precautions can be taken. So that is one.
In other words, you want them to adopt to the newer generation of communication and systems that they need to establish, because they have been working for 50 years on the same platform.
Correct.
So they need to adopt.
So, and there has to be alerts also. There has to be alerts, and sometimes there has to be some regulations also, because the COVID, how it came from bats, so many things. So all this, there has to be a periodic exchange of information about various new diseases across all nations. That is one thing. And WHO also should, of course, they have various guidelines. From time to time, they are coming out with various guidelines, international agencies, and we have societies for every disease, for every organ. We have a professional bodies. So that I think most important, we have to create awareness among the common man. So among the professionals, it is known, but among the common man, among the common public, we have to.
I tell you what, Dr. Manjunath, living in the West and knowing you for years and years, I always had this dream that people like Dr. C.N. Manjunath should be involved at the highest levels, whether it is country or international, World Health Organization or whatever. I know that God has plans for you, and the country has plans for you, and the world has plans for people like you. Your achievements and your work is the very best I have seen, not just from a medical standpoint, but you as a human being, your value system. You can be a mentor to anybody on earth, and we thank you for what you are.
Yeah.
We are very proud to know you and be small part of your wonderful life in a way. We thank you for that. Now,
Other thing I wanted to share, my real textbooks are my patients. I have learned a lot of lessons from patients. See, during my tenure, 18 years as a director of Sri Jayadeva Institute of Cardiovascular Sciences, during my tenure, nearly 75 lakh outpatients were treated, and 8 lakh procedures were performed. This includes angiogram, angioplasty, stenting, valvuloplasty, pacemakers, device closures, and open heart surgery. To the best of my knowledge, not even one patient is either delayed or denied a treatment for the want of money. That I have ensured.
incredible.
So this is where we have to really this thing. So definitely India is marching, because we have nearly 800 medical colleges. But my only worry is, it's not the number that matters. The quality of these medical graduates is important. The practical training is important. Hands-on training is important. So on one hand, we are increasing the number of seats, that's okay, but we have to ensure that they are all well trained and they have a very good experience. So of course, probably by 2027, we will be reaching our target of 17 lakh allopathic doctors. Right now we have 15 lakh allopathic doctors. So afterward, that's where the quality is very, very important. Another word, my message to the younger generation doctors is, you always understand the financial dynamics, you understand the financial landscape of a patient, financial background of the patient, and within that financial background, you decide how best to give a quality care. That's very, very important. And treatment should not be more harmful than the disease. When you know pretty well. For example, of course, that is my way of thinking. There is a end stage cancer patient. We know pretty well his life expectancy is just 3 months. You have to provide a supportive, sympathetic palliative care rather than doing a lot of adventures on them and providing immunotherapy, giving chemotherapy that makes them sick. When you are convinced his survival is not going beyond 3 months. So that's sort of this thing. So decision making in our profession, decision making is more important than incisions. Decision making is more important than interventions. And treatment should not be more harmful than the disease. So this is where there has to be some sort of an intellectual, professional honesty and integrity. So
that's amazing, Dr. Manjunath. You also mentioned earlier that 30% of the patients are treated at government hospitals and 70% at private institutions, private hospitals. And past your retirement from Jayadeva, you have that motivation and you associated yourself with a hospital named Bangalore Hospital, where you have, I had a chance to visit one of the Bangalore hospitals to get some tests done, regulatory tests done, and I already see a Jayadeva attitude there amongst all staff, all doctors, and you are even making it affordable at a private hospital, and you are bringing your Jayadeva culture to private institutions. Would you please try that across the border and connect these dots between the reason is people are afraid to go to private hospitals generally on many grounds, thinking that their bills will be too high. You started, I'm not trying to promote a hospital, but when I visited Bangalore Hospital, I saw that the Jayadeva culture is there with regards to charges, services, and the motivated staff and doctors. You have already brought that. Would you be able to expand that on a leadership at India level to bring that culture and coordinate efforts between private hospitals and government hospitals so that people feel extraordinarily comfortable to go either place?
Yeah, I think this is where some health insurance system should come. But again, health insurance also should be reasonable. Just because somebody has got an health insurance, they should not be exploited. That's also there. See, this is where, for example, in this hospital where I have moved out from government hospital to a private hospital, I should be very thankful to the management because they agreed. Because I told them I wanted to be in touch with the middle class and lower middle class, which I have been doing all 35 years. So even in a private hospital, I should be able to treat them at an affordable cost or to suit their pocket. So I think this is where magnanimity of the management is important. So it may not be there in every big. At least my appeal to all corporate giants, hospital giants, anyway, they are going to, that's what I am telling, volume come revenue model. Even a private hospital, even a corporate hospital with a bed strength of more than 100. I am not asking about smaller hospital. Those private hospitals which have got a bed strength of more than 100, they can still treat at least 5% of their patients, poor patients, at an affordable cost. So that's only we can make an appeal. We can't make a law actually. We can appeal, and they should also take it as a part of CSR, corporate social responsibility. So I think if the Prime Minister of the country appealed to all the hospital heads of a very big corporate hospital, they might come on the board.
I think I would like to say to our audience, and if the people in healthcare facilities and hospitals are watching this show, we don't need a better role model than Dr. Manjunath to really understand his efforts of bringing some parity between the services provided by private and public hospitals. And I commend you for that because I see a change at the Bangalore hospital that I went through, and I want to see that every hospital takes up this model and where patients feel extraordinarily comfortable and trust the doctors. See, the biggest thing about Jayadeva when I came here, of course, it was affordable, but the trust in doctors and healthcare professionals who work there is greater than many of the private hospitals we go, and I commend you for that. So, I tell you what, I think we had a great conversation. Thank you, and we do have a small segment called Favorite Five.
Okay.
So, it is something that we want to do so that the younger generations and others look at it. So, here is the favorite five I would like to ask you. What is your favorite sport?
Cricket.
Awesome. Have you played cricket at some level during your this
Yeah, yeah. I used to play cricket in school and colleges. I used to play. Of
And
course,
do
I never got into it was not a professional this thing, but it's an amateur this thing. But I still keep watching cricket. I'm very much obsessed watching cricket on television.
Awesome.
I always watch even if it is midnight or beyond midnight, I still watch cricket. That is this thing.
Actually, as a doctor, I'm sure you'll agree that some good, healthy pastime with music, cricket is very healthy for the
And also,
physical health.
whenever I go home after my hectic schedule, I watch cricket and news channel just for about 10-15 minutes, not long. And I watch a lot comedy channels.
Ah,
That
okay.
like comedy.
Awesome, awesome.
Yeah.
So the next question can be tricky because you don't want to offend one over the other. But who is your favorite film actor?
No, as far as Kannada is concerned, Rajkumar was our favorite film actor.
I agree with you there. Okay, so yeah, all right. So what's your favorite travel destination? I don't know whether you have time to do it, but what would be your favorite travel destination if you were to go and
Travel
take-
destination is actually jungle lodges. So that is where,
Oh.
because amidst forest there will be guest rooms,
Yeah.
and you can be with
See
nature.
nature. Awesome.
So that's what.
Awesome. What's your favorite food?
My favorite food is a curry with a lot of vegetables.
Vegetables.
Yes, that-
With less oil.
Less oil, yes, less oil.
All right. Last, but it's just, I'm inquisitive. What's your favorite color?
My favorite color is black and white.
No gray areas.
Yeah.
Awesome, sir. That is a great answer. Now, before I go to the next part of my thing, I would like to pay my utmost respect to Mrs. Anasuya Manjunath, whom I have met a couple of times, and she's a great soul, a great strength behind Dr. C. N. Manjunath's previous, current, and future achievements. Hats off to Mrs. Manjunath and family.
Yeah,
Would you like
on
to
this
say
show,
something
yeah.
about it?
In fact, for my success story, I think she is a great, source of inspiration, support. Virtually, in fact, I dedicated myself to the profession and to the hospital, and everything she has taken care of. So I think she has got an equal share in my success, equal share in my popularity, equal share in whatever gratitude people are giving back to us. So this thing. I thank my children, Dr. Satvik and Dr. Namrata, because they have tolerated my absence, and they have tolerated me because I could not take them to many places. I could not make them relaxed any time.
So, Dr. Manjunath, I want to, first of all, before we end, I want to say that on behalf of Festival of Globe, Silicon Valley, United States, RJ Media, and our chairman, Dr. Ramesh Japra, we are very pleased and honored to bestow our Global Iconic Hero Award for you and for your outstanding decades of services in medicine and beyond. So thank you so much.
Thank you.
It's our pleasure and honor.
Thank you.
for
Very nice.
Thank you so much.
I really enjoyed this show.
Thank you, sir. Thank you.
This surely is a great platform to connect our iconic heroes to everyday hardworking people across the globe in every walk of life and provide them an opportunity to understand, get inspired, and emulate so that they can transform their own lives and surroundings to achieve extraordinary results. I thank all our audience for joining us here and we look forward to welcoming you to our next episode of Iconic Heroes, where we will continue to bring exemplary leaders and their achievements to share with you. This is Meghana Raj, along with Kris Murthy, thanking you all once again and signing off from our inaugural edition of Iconic Heroes.